Hey everyone, let's jump right into this explainer. Today, we're going to explore the literal life or death stakes behind the invisible shield of regulations that keeps our medications safe. Whenever you pick up a custom-made cream from the pharmacy, or maybe you receive an IV at the hospital, there's this massive, highly detailed regulatory framework working entirely behind the scenes. It's all there to ensure that whatever goes into your body is pure, potent, and safe. So we are going to be unpacking the United States Pharmacopoeia, or the USP, compounding chapters.
Here's a quick look at our game plan. We'll start with the core authority of the USP, and then we're going to zoom into 4 specific domains. Chapter 795 for non-sterile, 797 for sterile, 800 for hazardous drugs, and finally 825 for radiopharmaceuticals.
All right, part 1. The core authority of USP and how they set the gold standard. To really get why this matters, we first need to understand what the United States Pharmacopoeia actually is. Basically, they set the benchmark for the identity, the strength, and the purity of medications. But how exactly does that apply to what your local pharmacist is doing behind the counter?
Well, understanding this is absolutely crucial. See, true compounding is highly regulated, whereas simply adding water to an antibiotic suspension, that's just reconstitution. Compounding is a totally customized process. It's actually exempt from the incredibly rigorous requirements of a new drug application from the FDA. But, and this is a big but, only if the compound is made by a licensed professional who is strictly following these USP chapters.
But here's a pretty surprising twist. The USP, they don't actually have compounding police. They literally just write the rules. While the FDA and state boards mandate these standards, it's fascinating that the USP itself leaves the actual enforcement up to the legal authorities. The state boards of pharmacy, the FDA, and accreditation organizations, those are the ones who actually come knocking on the door to make sure a facility is playing by the rules. Moving right along to part 2, USP 795, non-sterile compounding and the foundations of safety. This chapter really builds the bedrock for safely compounding everyday preparations. Think creams, capsules, oral liquids. And keep in mind, this applies to both human and animal patients in any healthcare setting. Now look at this, because there is a massive difference between an expiration date and a beyond use date, which we call a BUD. An expiration date is something slapped on by a massive commercial factory, but a BUD? That's assigned by your local compounder for one very specific preparation. A BUD is the exact date, and honestly, sometimes even the exact hour, beyond which a compounded preparation absolutely cannot be used.
And it largely comes down to water, or what the source material refers to as water activity. This is really interesting. Notice how the amount of water in a product dictates its maximum beyond use date. That's to prevent dangerous microbial growth. For example, if a compounder makes a non-preserved aqueous dosage form, meaning it has high water activity and no preservatives, it only gets a 14-day BUD and has to be kept in the fridge. But if they make a non-aqueous formulation, like a capsule or an ointment, that can have a BUD of up to 180 days. Basically, water is the absolute enemy of stability here.
And to keep track of all this, USP 795 requires some seriously rigorous documentation. You can think of the master formulation record as essentially the master recipe. It contains all the instructions, the calculations, and the labeling requirements to ensure you can reproduce it perfectly. On the flip side, the compounding record is more like a historical diary. It documents exactly who made a specific batch, with what exact ingredient lot numbers, and exactly when they made it. If there's ever a recall, that compounding record is literally what saves lives. Okay, let's turn up the heat a bit. Part 3, USP 797, sterile compounding and preventing contamination. Here, the stakes are so much higher. Contamination in a sterile compound could lead to a fatal blood infection from an IV. So this chapter covers anything intended to be sterile: infusions, eye drops, tissue implants, you name it. The requirements step up significantly. Now, the number 5 here refers to ISO Class 5. That is the strict, absolute minimum air quality requirement for the primary engineering control, which is just the technical term for the hood where the sterile mixing actually happens. To give you some perspective on how clean this is, the air in a typical room is ISO Class 9, meaning it carries literally millions of microscopic particles. ISO 5 is a totally different, ultra-clean world. The air must flow in a single, unidirectional path just to sweep any potential particles right away from critical sterile sites, like needle hubs. The engineering that goes into a clean room is just incredible. Think of positive pressure, kind of like a slightly inflated balloon. When you open the door, air immediately rushes out, which physically prevents microscopic contaminants from sneaking their way in.
A non-hazardous sterile buffer room is constantly pushing air out at a pressure gradient of 0.020 inches of water column. Conversely, negative pressure acts more like a vacuum. It keeps hazardous airborne particles trapped safely inside the room where they belong. And, to maintain these environments, the personnel have to continuously prove their competency. It's not just a one-and-done test. There's rigorous, documented testing of all these core skills. You can't just read a manual. You actually have to pass a gloved fingertip test by pressing your sterile gloves right onto an agar plate to prove you didn't contaminate them while getting dressed. You have to pass media fill tests that simulate the most complex compounding you'll ever do. It is a continuous, heavily monitored process just to prove that you are safe to compound. All right, so we've spent a lot of time talking about protecting the patient, right? But what happens when the drug is actually hazardous to you? That question leads us perfectly into our next regulatory pillar, where the focus entirely shifts from the safety of the patient over to the safety of the healthcare worker. So here we are at Part 4, USP 800, Handling Hazardous Drugs and Occupational Safety. This chapter mandates strict standards for handling absolutely any medication on the NIOSH hazardous drug list. And this applies to everyone. Pharmacists, sure, but also nurses, physicians, veterinarians, and even anyone transporting these drugs. Because these drugs can be carcinogenic, genotoxic, or even cause organ toxicity at really low doses. Just skin contact or inhalation by a worker is a major occupational hazard. We're talking about severe, chronic risks to the people who are literally just trying to do their jobs. So USP 800 steps in and requires that these drugs be stored and compounded in those negative pressure rooms we talked about earlier, which must be vented entirely to the outside of the building. Protection in this environment relies on strict layering. Just notice the requirement for 2 pairs of shoe covers. That's so the outer, contaminated pair can be pulled off before anyone tracks those hazards into the rest of the pharmacy. You have to wear 2 pairs of chemotherapy-tested gloves, and your gown must be disposable, close in the back, and resist permeability. And all of this PPE, it's considered completely contaminated the very second you finish your work. And when it comes to cleaning up hazardous drugs, you can't just wipe down a counter with a paper towel and call it a day. It is a highly specific 4-step sequence. First, you have to use an agent to chemically deactivate the drug residue. Then, you decontaminate the surface to actually remove it. After that, you clean it with a detergent. And finally, you disinfect the area. Skipping even one of those steps puts absolutely everyone in the facility at risk. Finally, let's hit Part 5, USP 825, Radiopharmaceuticals. This is our 4th and final compounding pillar, and it governs the highly specialized world of radioactive materials. This is a wild area of pharmacy. Authorized nuclear pharmacists actually work in these highly specialized rooms, literally called hot labs. They safely dispense radioactive materials that are used in advanced imaging and medical treatments. Because these drugs emit radiation, the engineering controls and the handling procedures are totally different from what we just discussed in 797 and 800. It requires its own dedicated chapter and incredibly strict licensing. Understanding these USP chapters really gives us a newfound respect for the invisible, life-saving rules that our pharmacists follow every single day. From meticulously monitoring water activity to balancing invisible walls of air pressure, the preparation of customized medicine is truly a marvel of modern safety. So the next time you or maybe a loved one receives a custom compound, ask yourself, just how many invisible layers of protection had to work perfectly to get that single dose safely into your hands?